How do you take care of yourself when you are experiencing traumatic grief? It's easier said than done. I mean, oftentimes people will kind of flippantly say, you need to take care of yourself, you need to take time for yourself. But what if you are experiencing that traumatic grief? What if you are in the midst of trauma and the fears and the actual trauma is not over? That is part of my story. My name's Cristi Bundukamara. I'm a psychiatric nurse practitioner, expert in traumatic grief because I've been through traumatic grief. I lost a son in 2005, and then shortly after, another son started having catastrophic epilepsy, and I had 10 years of medical trauma enmeshed with grief. I ended up losing that son, his name was Reggie, to his disorder, and then later suddenly lost my daughter in her sleep. So I know grief and I know trauma, and I am just now learning to truly be able to take care of myself. And I wish I started this journey 10, 20 years ago. I was in fight or flight. I took care of myself the best that I knew how. I thought I was taking care of myself, but I realize now that self-care is more than just taking a night out with your girlfriends or getting your nails done. It's comprehensive, and I want to talk about that for a minute. So if we start with Maslow's hierarchy of needs, this triangle, we learned this in elementary school. If you took a psychology class in college, you know what Maslow's hierarchy of needs is. And we think that we have a lot of the foundational things. Maybe we have a house, we have shelter, we can buy food, we're capable of sleeping, right? Like, we think that the foundational piece is not a problem. And so, we focus on safety and we think that, okay, we live in a house, we're currently safe. But for example, when I was going through that 10 years of medical trauma with my son, I was not emotionally safe. There was this constant fear of Reggie dying. And that is trauma. That's not safety. And could I have felt safe in the midst of that? I don't know. Not likely, right? Like, you have to be out of the trauma to begin to feel safe. And I couldn't get out of the trauma. That is my son. I'm going to do everything that I can to save his life. So when we think about these Maslow's hierarchies, I want you to visualize that there could be holes in your foundation, which makes it really hard to have good self-esteem and self-actualization that we talk about at the top. So these holes at the bottom is where we need to focus. So if you are in the midst of trauma, the self-care is foundational. Like, can you create a solid foundation of these physiological needs? We don't talk about this enough, but part of that foundation is sleep. And many Americans, I think the statistics are over 50% of Americans, do not get adequate sleep. Sleep is when our body heals, it recharges. And so if you are in the midst of trauma and you are having difficulty sleeping, maybe you have a special needs child and that child wakes up in the middle of the night, or there's fear in the middle of the night and sleep is an issue. Part of your decision making and your self-care is, how can I orchestrate my life to get some sleep? And, I can hear you saying, but I can't. This is a foundational thing. If you do not get sleep, any kind of self-care is a waste of time, right? That is when our body heals. And so instead of going for that nail appointment, take a nap. Sleep needs to be a priority. It is a foundation. Substance use is a problem that I often see. And sometimes when we say substance use, we think, I'm not using drugs, I'm not doing anything bad. I drink a little bit, use a little bit of cannabis. Both alcohol and cannabis have some long-term negative effects. It does decrease neurotransmission and can impact the physiological foundation of health for you. And so in your self-care process, I want you to look at your substance use. Now, I know there's some people who are using cannabis as medicine and they need that rather than a medication that is maybe has worse side effects. That is a risk benefit, right? Like, I'm not saying you don't ever use cannabis, but if you are using cannabis to relax, to sleep every night, are you disrupting some normal sleep patterns, some normal rhythm? I often see people using alcohol, have a glass of wine a night, 2 glasses of wine a night. It's the way I relax and get to sleep. We know that alcohol disrupts sleep. We know that alcohol decreases neurotransmission and is going to increase stress. So I am not passing judgment. I personally do use alcohol socially on occasion. I'm saying evaluate in your self-care practices, evaluate your substance use. And is it really part of your self-care, or is it hampering self-care? Nutrition. The nutritional diet of Americans is systemically very poor. Processed foods, not real fruits and vegetables. And, this is a long journey, a long topic around nutrition and mental health. But in your self-care practice, evaluate your nutrition. I heard this once and I will repeat it. Love food that loves you back, right? Love food, find things that you love to eat that actually nourishes your body, and maybe decrease the amount of processed foods and high sugar things that are potentially decreasing your self-care and your overall mental and physical health. There's a brain-gut connection that we talk about, that if you are experiencing depression and anxiety, we have serotonin receptors in our gut that impact how much serotonin we have in our brain. Serotonin is the neurotransmitter that we associate with depression. And so when you are in the midst of grief and trauma, you are likely experiencing some episodes of depression. And that could be part of the normal process, but it could be compounded and magnified by not having good gut health, which goes back to nutrition and things like that. So overall, understanding your physical health, go to the doctor, follow up on the things that the doctor is telling you, and take ownership of how your physical health could be impacting how you're responding to this grief and trauma. Now, nutritional supplements. There's a million influencers out there supporting a specific supplement. And this supplement, if you just take this supplement, it'll take care of your depression, your anxiety. I have gone down multiple rabbit trails in this nutritional supplementation. Between trying to save my son and treating myself, I've probably spent over $200,000 in nutritional supplements. It's not a bad road to go down, but don't just jump in and go with the latest fad or be taking multiple new things at one time, right? When you decide, I would like to see if this nutritional supplement would help me, I want you to take that by itself with no other new supplements for a period of time and really evaluate, do I feel better, right? Because if you take it and you don't feel any better, why are you wasting your money on it, right? So just, again, being in charge of that self-care. Nutritional supplements are not bad, but they can be a waste of time and money. Do the treatments that your doctor recommends, psychiatrist recommends. If you are seeing someone for mental health concerns, doing the things that they recommend. Mindfulness and meditation, maybe some biofeedback, neurofeedback, and take your medication as prescribed. I think this is one of the biggest problems in the self-development space of people who are teaching you how to take care of yourself. They are so anti-medication, like Big Pharma is trying to take over the world. Medication, there is a time and place for medication. And if you have been prescribed medication or you need medication, take your medication. That is part of self-care. If you don't want to be on that medication, look at a long-term plan with your doctor to come off of that. But make sure you're treating what you were on that medication for to begin with, right? That is self-care. Managing stress is self-care. I can tell you I continue to have a problem with this. I'm a type A personality. I have been through traumatic grief, and I am still in a fight or flight response often. And I wear like a little Garmin, and it tells me, oh, your battery's empty, you're too stressed today. And I'm working on that. And that's part of self-care, is trying to manage the stress. And we often blame stress externally. Like, well, this is going on, this is going on, this is going on. And if you are in the midst of trauma, you're right. That trauma is impacting your stress level. But we do have some techniques where we can decrease the response of our stress. And that goes into, I often talk about self-care as an umbrella of what I call the 5 selves. And self-regulation is part of that. What does self-regulation mean? Self-regulation is, can I regulate my response, my emotions? Have you ever met someone where their emotions are right there on their sleeves? Like there's, they just bring it out to the table and it kind of impacts everyone around them. And it's obviously impacting them. Or maybe you're that person, or maybe you're the person who thinks you're self-regulating, but internally it feels like chaos. Self-regulation is not just keeping it inside, but it's actually regulating inside and how that is impacting you. That is part of managing stress, managing emotions, and managing if you are experiencing traumatic grief. So what can you do? There's tons of techniques, research different things, but especially when it comes to grief and trauma, I want you to think and learn about breath work. So in Chinese medicine, the heart holds pain, and the heart holds trauma, and the lungs hold grief. So if you have experienced traumatic grief like I have, you may be experiencing a tightening of this area of your body, maybe not physically yet, but energetically. And so, maybe you're not taking deep breaths, or you're shallow breathing, or maybe you're in the midst of trauma and you're literally emotionally holding your breath because of fear of what's next. Doing breath work gives you a little bit of control back, right? So if you're like me and you're raising a special needs child, or a child who is in, medical need, or your spouse is in medical need, and you are constantly still in this fear and trauma, but it's meshed with grief, right? And you have no control over those things. You have no control over that person's illness, and you are committed to being their caregiver. How do you take back control? You begin to do breath work. And there's lots of different breath work. There's diaphragmatic breathing, there's box breathing, there's this 4-7-8 breathing. One of my favorites, and I'm going to stop and show you, is alternate nostril breathing, where you inhale in one nostril and then exhale in the other nostril. It's hard to do and talk at the same time, right? But you're holding one nostril, inhaling, then switching and exhaling. I find that one to be the most beneficial. Like, I can feel the anxiety decrease right when I'm doing it. But look at different breathing exercises, breath work. It gives you back some control. Some other things that you could do, the vagus nerve is a nerve that goes directly to the brain. If you hum, if you sing, it stimulates that vagus nerve and decreases the anxiety and the stress level. Acupressure points. These are all things that you can research. Some people like to squeeze between their thumb and pointer finger. Some people do the pressure point on their wrist. My favorite is the one under the clavicle, because this meridian goes directly to the adrenals. And when I push here, I feel that adrenal response kind of decrease. So again, this is not about, a specific technique. This is about, what are you going to do for self-care? Can you find something that actually helps you self-regulate? Now, when I talk about the 5 selves, right? Self-care, self-regulation, what about spiritual self? This is really an important part of traumatic grief. Maybe you have a strong belief system spiritually, or maybe you are angry or don't have any belief system whatsoever. Wherever you are on your spiritual walk, I encourage you to continue to evolve and figure out kind of that spiritual self. Who are you spiritually? Connecting with your God, connecting with nature, connecting with yourself. Whatever that spiritual connection is, that is a part of self-care, especially in the midst of traumatic grief. And grief always brings up spiritual conflict, right? Like, even if you have a strong belief system and the person you love is in a heavenly place, you still might have some anger at God for allowing it to happen. Like, there's still a spiritual component to your grieving process. And so just explore that. Take the time to figure that out and acknowledge that that is part of self-care. Prayer, meditation, mindfulness, whatever you need to continue to grow in your spiritual self. Self-improvement. I kind of flippantly have said multiple things throughout this video of like, oh, you could do this, you could do this. And maybe you're like, well, aren't you going to teach me how to do it? That is part of self-improvement. Do a Google search and like learn, read a new book about meditation, read a new book about prayer, read a new book about self-regulating your anxiety, whatever. Like, self-care is your journey. I can't tell you exactly how to do it. I can tell you the components that I have learned in my self-care journey through traumatic grief, but you are in charge of your own journey. And I'm here to give you ideas and to guide you along the way. But when I say self-care includes self-improvement, that includes you learning what works for you. I remember shortly after my daughter passed and I was going through my 45 days of grief, which I have a grief documentary about that. I clearly remember thinking, I don't know how to take care of myself. I don't know what fills my cup. I am almost 50 years old and I don't know what I want to do. I would go for a run because people say that's good. I started lifting weights because they say you should lift weights at, when you're 50. I started doing these things and everything was what other people said I should be doing. And I stopped and thought, but what do I want to do? And so part of my self-improvement journey was figuring out what actually works for me. And so I recommend you, continue that journey, find books to read and find movement. I talked about the running and the lifting weights, and I hate both of those things. But what I love is yoga, and that is my self-movement. We talk a lot about processing grief and trauma, but then, maybe we go to a talk therapist or we talk to our friend and we're like, yeah, but I'm just saying it over and over again. It's not getting better. Processing grief and trauma are different, and you must separate the grief and the trauma because the pain of grief is your badge of honor. You are allowed to hold that grief forever. But if you hold on to trauma, you will cause chaos in your brain. And so when you process trauma, it's about movement. You move it out of the body. Professionally, we do things like EMDR, which is eye movement desensitization, biofeedback, right? These are all movements, but there's other things. Yoga is movement. I do a lot of my healing in my yoga class. Sound healing, like sound is a vibration and that's movement. And so when I say self-movement, it's finding the movement that helps you to get the trauma out of the body. Because grief is different. And grief, you must feel the pain of that grief, but it should come in waves and decrease and not cause a spiral of chaos in your brain. That's how you know it's enmeshed with your trauma. Continue watching. I'd love for you to watch this post-traumatic growth video. I'd love for you to attend my grief intensive where you come to Colorado Springs for a week and we get down to the nitty-gritty of everything that I've just talked about. How do you take care of yourself? How do you get through this trauma grief story of yours. Click on the link below and find out more about the Grief Intensive.